You know, as a follow-up to that, I know one of Men's Health Network's initiatives has always been to build a speakers bureau and a board of advisors of medical professionals and other healthcare professionals that have a stake in the game with this. Do they, I don't want to say carry more impact or resonate better with you all in the community? That would you like to hear just as much from them as you would from someone like myself who's a staff person of the organization? You know, say if I bring in someone like a Dr. Bonhomme, who was with the National Black Men's Health Network, who's an MD, MPH, you know, affiliated with Emory University in a hospital and things. You know, if he would come and speak in someone like my place, does that carry extra value, extra weight because he's an actual practitioner out there in the community, whereas, you know, I'm a staff person from an organization?
Well, certainly we always appreciate smart people and expert people sharing information. A lot of the researchers at NIH and the institute directors at NIH are experts in their field, and so we have a lot of governments within a lot of experts within the government, and I'm just speaking for myself, but hearing from people like you is very, very valuable. You are the advocate for your area, and sometimes hearing what the people think, what people on the ground floor think, is a better way for us than hearing from smart people. As I said, we're surrounded by smart people. Go ahead. I don't want to in any way say that we don't want to hear from experts outside of the government. We obviously do that all the time. The Secretary's FACA on Healthy People 2020 are all experts outside of the government. But scientific experts, as opposed to some people like you, I think you would certainly be at least equal to as far as influencing us.
It's great because, you know, a lot of our members are the common person that want to come and get involved in this, and, you know, for us, you know, I'd love to bring their voice to the table.
Absolutely.
And, you know, I think one thing, you know, for them to hear on the video presentation is that their voice, you know, carries as much weight as others. So,
right, and that's what I was going to build on to Penny's. It's, you know, we see you're the Washington rep, you know, but it's always good to see who you represent.
Right.
To see that there's, you know, there are people behind your message, so whether they're experts or not.
And I find that different people serve different needs. I mean, there are times when you need the scientific expert to give the exact information and to get the data right. But there are times when I want to talk to a staff person who understands what I need, who knows how to get me information in a timely fashion or connect me with the right people, or who can educate me in a minute and a half if that's what I have to get a soundbite down. So I never underestimate the power of a good staffer.
Are there other avenues for national and local organizations to become a part of Healthy People 2020 beyond these regional meetings?
Yes. We want to encourage everyone to stay in touch with us through the web at www.healthypeople.gov. There is much information available and places for public comment. As Carter said earlier today, because of the advancement of the web and the internet, we now have many more ways other than meetings like this than we did when we were developing 2010. And so we certainly hope that people will take advantage of electronic means of communication. All of those comments are looked at and categorized. We take them just as seriously as we do live comments like you provided for us today. So please encourage your folks to get on our website.
We definitely will do that.
And there's also the advisory committee meeting next week, which will be a venue for oral public comments. And you can submit comments to the advisory committee as well. Though any comments we get, we will of course feed to the advisory committee, so there are different ways to do that. And of course, people come to visit us all the time. And
Great. Well, we'll definitely get our constituents involved. How important is it for organizations like Women Against Prostate Cancer and Men's Health Network to get involved in national health policy debates?
Crucial. Don't you all agree?
Yeah.
I think, you know, the whole point of this open and transparent process is to get people just like you at the table. We don't want to sit around the table and talk to each other. We want to hear from you, and that's the purpose of these meetings, of having every advisory committee meeting open to the public, et cetera, et cetera. So we definitely think it's very important. And I do want to tell you that on the Women's Health website, there is a men's health page. Are you all aware of that?
Yes, yes.
And that is an area where your constituents, your supporters, can learn more about what is going on with men's health at the Office of Women's Health. As I say, Wanda Jones is very inclusive and takes this very seriously. So that's another way.
Great.
That's great. I know she's been kind enough to put external links to our organization,
Right.
some of our publications. So, I can't say thank you enough for reaching out to spread the word about health information for the entire family.
Right.
That's great.
Definitely. Well, what other information sources are coming from Healthy People 2010 that might be relevant?
Well, we're continuing our progress reviews. We just had respiratory health
Respiratory
last week.
diseases last week.
And there was a mid-course review that took us through the middle of the decade. And we will have, at the end, we will have a final report of the progress or lack of on all of the objectives that we have worked on during this decade. So all of that is available. What
And
else?
also Richard mentioned, Richard Klein in his talk this morning, a workshop that was held at NCHS a week ago, or May 19th it was held. And that is looking at how are we going to measure the elimination of disparities for the Healthy People 2010 final review. So something will be coming out of that, and that should be very relevant to you all looking at the gender differences. Because as he said, we have this goal to eliminate disparities, but we're not quite sure how to measure that. And it's something that wasn't thought of when that goal was established. So a lot of thought has gone into exactly how we measure disparities. So that'll be something new and different, very important coming out of Healthy People 2010.
And of course, almost all of this information is available at our website. If you go to healthypeople.gov, you can click on to implementation and just see whatever you need to know about the progress reviews, the mid-course reviews, and of course the final review when it comes out. And if you hook on the data section, you can get to the National Center for Health Statistics website and see what they have to offer as far as data collection issues and data trends.
Great.
Fantastic.
Any more questions? Okay, well, great. Thank you all so much for helping us out, answering some questions for us.
It's our pleasure.
Great.
We look forward to
Thank you.
continue our work with you guys. So
Great.
We do
Definitely.
too.